Welcome to the banker lamp. Please enjoy the video.
You begin by choosing the right ball size and finding the exact tender spot. This matters because pressure concentrated on tissue creates change. Place the ball between your body and a stable surface. Once positioned, slowly apply body weight until you feel moderate discomfort but not sharp pain. Hold steady for 30-60 seconds while you breathe into the area to let the muscle soften. If sensations ease, you can increase pressure slightly. Make sure to avoid bone contact and keep movements minimal at first to assess tolerance. Once you have a steady hold and the tissue begins to relax, add controlled mobility to encourage fluid redistribution and neuromuscular reset. Apply sustained pressure for 10-20 seconds, then perform small 1-3 cm rolls or directed movements for 5-10 seconds. Repeat cycles for 2-3 minutes. You do this to balance mechanical pressure with movement-driven circulation. Keep the range small, watch pain levels, and breathe evenly. If the intensity becomes sharp, reduce load or reposition. This combination, you finish by tapering pressure. Hold a lighter, soothing contact for another 30-60 seconds and follow with a gentle active stretch to reinforce new range. Then reassess the area's mobility and compare to the other side. Make a note of any lasting tenderness. After a session, hydrate and allow 10-15 minutes of rest for tissues to settle. If you encounter sharp or radiating pain at any point, stop immediately and either reduce pressure, move to surrounding tissue, or consult a healthcare professional. That's the key troubleshooting step to avoid harm.
Thanks for watching. If this was helpful, leave a like and consider subscribing. See you next time.